This is always the fun part of the year / tough part of the year, meaning that, you know, you get to work with the board chair over the course of the year, and that's a relationship. And we've been privileged for 2025 to have Diane Hansen as our board chair. Diane's a fantastic person. If you haven't got to know her, but very thoughtful, always a good sounding board, and really just want to take a moment to thank Diane for her leadership this past year. So Diane, if you'd come up, please.
Thank you.
Thank you. Well, Demetrius offered to give me a couple minutes to add my thoughts for today. I don't know, he may regret that afterward, but but as president and CEO of Palomar Health, it's an honor to be here among so many of our region's healthcare leaders, advocates, and partners who share the same goal: to care for the communities we serve. This past year has been filled with inspiring moments that remind us why we do this work. Moments of progress, purpose, and resilience that reflect the very best of our industry. Across California and across the nation, I don't have to remind you, health systems continue to face mounting financial pressures, workforce shortages, and an ever-changing regulatory landscape, as you all just heard. We've navigated the lingering impacts of the pandemic while preparing for the next wave of challenges, from proposed Medicaid cuts to the rising cost of care. And yet, despite it all, each one of us continues to show up. We continue to innovate, to advocate, and to lead, because at the heart of healthcare lies a shared purpose: to serve, to heal, and to make a meaningful difference. Every patient we treat, every family we comfort, and every team member we support is an example of the purpose that drives us. We know that the strength of one organization is powerful, but the strength of many, each united in purpose, is transformative. That's what gatherings like this are all about: sharing our experiences and learning from one another. Together, we stand shoulder to shoulder to ensure equitable access to care, protect the most vulnerable among us, and preserve the future of healthcare for generations to come. As we look ahead, we must continue to embrace collaboration over competition and community over isolation as our most powerful tools for change. Thank you for the work you do, the stories you share, and the compassion you bring to this calling we all hold so dear. Thank you. It has been a privilege to serve as the chair for this board this past year, and I want to take just a minute to say thank you to Demetrius, an exceptional leader for this organization. He lives and breathes all of our challenges, and even if you don't work with him on a regular basis, like I've had the opportunity to do this past year, he is doing everything he can to advocate for us. This team, and I'm looking at all of the folks, and there might not be some in the room, but incredible commitment to healthcare, to us, to supporting us. And so a big thank you to this entire team, and thank you, Demetrius. And not just because they put on this amazing annual meeting every year, we appreciate the work they do every day. So thank you.
All right, so now this is the fun part of the program. Every year we give out a couple of community leadership awards. This is our attempt to recognize those leaders, those community benefit organizations, those electeds who are doing great work in the community. So for the first award, Pablo, if I could call you up, please.
Thank you. It is my pleasure and honor to recognize Senator Steve Padilla with the Community Leadership Award. And Senator Padilla has an extensive resume and a lot of accomplishments I will highlight just a few of those. I don't know if you all know, but he was a police officer, a private detective, going way, way back. He served at the Chula Vista as a city council twice. He was the mayor of Chula Vista. He was appointed twice to the Coastal Commission, and one of the terms he serves as the chair of the commission. He has sponsored many, many bills. The latest ones include SB 243 and SB 57. One of them safeguard AI for young kids. And since he had sponsored some regulation on AI, I asked AI if they had any bad information about Senator Padilla. And it came back negative. No bad news about him. He has been instrumental in sponsoring and supporting AB 918. And for those of you who don't know AB 918, this was a legislation created to unite the healthcare districts in Imperial Valley. We had two healthcare districts, and the city owns a hospital in El Centro. So this bill consolidated the districts, and with the intention of selling the hospital to the district for $1 and unite the whole healthcare down in Imperial Valley. So we are on track to get that done by January of this coming year. Steve has been instrumental in helping us move the needle on that. And then the other thing that he has been instrumental and supportive is he has helped us with the distressed hospital loans that all these districts hospitals are facing financial distress. And he has been a big advocate, a big supporter of that legislation. So thank you for that. Last thing, he is a champion for the underserved community. And for all those reasons, you are our community champion for Imperial Valley.
Picture afterwards. Thank you.
He made me pay him to make sure he didn't tell you what AI actually said. So, good afternoon. It's really great to be in your company as always, and to just take a moment to express my gratitude to all of you, first and foremost, for the work that you do. Those that are in the business of managing these important critical delivery systems of healthcare, you guys are at the crux. You're at the crucible in our society, a key element that keeps holding us together as we continue to find new ways to care for one another, and to do so in a way that cares for more and more and helps get people access to care in ways that prevent criticality and people showing up in EDs for all of their primary care and all of the social ills that end up spilling over into your realm, into your world. And I know that those of us in the legislature, sometimes we do things that you like. There are some things, we do things, whether we intend to or not, that make your world a little more difficult. But I really am grateful to Diane and the board, certainly to you, Pablo. I've known Pablo for many, many years and watched you, utilize and demonstrate your leadership in multiple systems. And I think that the healthcare district in Imperial Valley is so lucky to have you. But I'm very grateful for this. He didn't mention that I did all those things before college or law school, so it was really impressive. I just want you to know that. People always find my time in uniform right out of high school as the most interesting piece of my biography, and I appreciate that, because had I not had an opportunity to see society and people at their very worst and at their very best, I don't think I would have had the personal tools to be able to try to offer myself in a way to be a partner and to be in government. And those lessons that I learned at that young period of my life have never left me. And they are related. They are related to my passion to try to do my part in partnership with you and others to help people's tomorrow be better than today. So I'm grateful for the work that you do, for your professionalism, for your hanging in there through some incredibly difficult times. We have more work to do ahead. You can always count me in as a partner, and I'm incredibly grateful for this recognition. It takes a village. It takes many. I was one of many, many pairs of hands. So thank you very, very much.
And then for the next one, Lindsay, if you would join me up here, please.
Good afternoon, almost. I'm Lindsay, and it's my honor today to be part of a group presenting our Community Leadership Award to Rick Wanne. And this is really special, and I wanted to make sure that we had colleagues from our community partners here as well. I'm going to ask them to say just a really brief few words in a second, but what's meaningful about our presence here on the stage is that we initially worked all together in advocacy, working to improve eligibility operations at the County of San Diego. And now, after things have been changed completely through transformational leadership with Rick and your team, we're here together to say thank you and to wish you well and to honor everything that you've achieved. And so, Jan, I'll hand it to you next. Go ahead.
Actually, I thought you were going to say more. I did. I thought you might, lay down the groundwork. I've only got a few minutes, so I want to just say a few things. I was here. I'm old. I was here with everyone, with the hospitals, as a member of a hospital before Rick Wanne. And so I think it's extremely important to note that what he brought helped us all, helped the community, helped the hospitals. And he actually acted like there was a mission to his department in terms of the people of San Diego. He also is one of the best, we have one of the best performing counties in terms of eligibility, and he's won a lot of awards as a result of that. But the biggest thing I would say is partnerships. Instead of staying locked up, Rick develop partnerships with universities, with CBOs, with schools, outreach. These were not things the county did before this. And he went where the people were, which is with clinics. I mean, just what clinics. He went where the people needed the service and partners even today. So I want to just say, personally, our organization, San Diegans for Healthcare Coverage, we primarily focus on aged and disabled and helping them retain Medi-Cal. And we wouldn't exist. Our programs would not be successful. We would not have made it if it hadn't been for our partnership with Rick and his believing in what we were doing in terms of reaching out to the most vulnerable, really the low-income seniors and disabled people in our community. We wouldn't exist. So I have one last thing to say before you kick me off. He's helped you, because I, of course, started the hospital outstation program, now called something else. And it was a fight all the way through. First as a hospital member, then as a consultant to the Hospital Association, fighting the county all the way. And with Rick and the Hospital Association, I believe that is a huge benefit to the hospital. It's quite different than it was when I first came in. So I want to say, with Rick leaving, it's in all your best interest that everything that he has built here not go away. That we don't let, what I find is, I love the Board of Supervisors, however, they're making some interesting decisions. And I want to make sure we don't start over, because Rick is also leaving us in really good hands. Yeah. So that was it. I'm saying that to you as a plea, because I'm going to be looking to you to partner to make sure that we don't lose everything we've gained. And thank you, Rick, for everything. Seriously.
now that Jan has checked off every bullet point on my talking points for Rick, let me pivot here. Oh, okay. Keep the mic away from Jan. No. Let me pivot here. I'm going to be Rick's angry Obama interpreter. Everyone knows the Keenan and Peele interpreter skit that was done several years ago. Rick's going to come up here and he's going to say, "This is too much. This is an honor that I don't deserve. I stand on the shoulders of giants. I work with an amazing team, and it's all nonsense. It's all nonsense." He hired the team. He changed the culture of the county almost single-handedly through his spirit, his commitment to service, his commitment to the community, and his commitment to improve the experience of consumers. From the moment they interact with a county individual and express need for help, he wanted that experience to be high quality, to be efficient, and to be correct. What a concept. We used to have a term amongst health advocates. Oh, by the way, I'm Jack Daly. I'm an attorney. It's not often you have advocates here standing up here to talk about how great a county leader is with regards to administration of benefits. That's Rick Wanne. That's the greatness of Rick Wanne. And I speak with attorneys across the state on a regular basis. They don't like hearing about San Diego. They don't, when they're commiserating about their poor interactions with their county, they say, "Jack, stop. You have nothing to complain about. You guys have an amazing," and we do. We have all the access in the world, and it's really a credit to Rick Wanne. So I think his transformation at the county that's most significant is that culture change. He came in with a culture that was not as outgoing, that was not as collaborative, and really, unfortunately, gained the reputation as being, instead of eligibility workers, ineligibility workers. Rick changed that. Rick single-handedly shifted the culture of the county to be open and collaborative and a force of change in our community. And so I'm honored to be here with Rick and to help celebrate him in this honor. Thank you.
Almost. So just to add to that, and Violetta, I know you're here somewhere, but we had our own experience reflective of exactly what you've heard from Jan and Jack, building our hospital outstation program. The first time that you started, when Violet and Scripps were starting the pilot, Rick was copied on every single email. For 6 months, for longer, he fixed everything, took accountability, taught his team accountability. And as a result of your partnership with us, your leadership building that program and changing it, we have patients that get access to care. We have patients that get access to care, to Medi-Cal, usually in less than 10 days, all the time. This is not something that is common other places. So we are honored, and we are so lucky. Under his leadership, you've helped more than 1 million San Diegans every single year access benefits that they rely on, work that strengthens families, supports health, and improves lives across our community. Your vision, integrity, and dedication to serving the most vulnerable have set a standard for public service that will endure long after your retirement. We're grateful for your partnership and the legacy that you leave behind. Thank you. Please join me in expressing our deep appreciation as we present this award.
I told you you're going to need a new crystal.
Thank you, Lindsay and Jan and Jack so much. And Demetrios, thank you so much for this great honor. I also want to thank whoever generated this AI picture of me, because I have no idea who that is, but this is a great honor to be here today with all of you to accept this Community Leadership Award. It represents, as mentioned, the partnership work between HASD&IC, all of the member hospitals, and the County of San Diego in administering the Medi-Cal program here locally, and also the other critical safety net programs. As in any great partnership, it requires commitment from all of the parties. toward a common goal. It requires a great level of effort. It requires maintenance, creativity, and it requires a willingness to change and pivot when the times require it. Our communities that we serve, our customers, need and deserve a strong partnership that exists today between all of the HASD&IC members, our community partners, and members who are in the room with us today, and the county to navigate the difficult times coming at the most vulnerable persons that we serve in our community. So on behalf of the County of San Diego, our Board of Supervisors, who you will see one of them here shortly, I am very proud and thankful to accept this award. So thank you so much.